Welcome to Decoding Healthcare Research. I'm your host, Efrain Riveros, Dr. E.F. Rain. Today, we are going to discuss a very important topic that is affecting many people in our country, is food allergies in the adult population. So we have the honor of having with us a very important author, Dr. Ruchi Gupta. She's the director of the Institute of Public Health and Medicine, Center for Food Allergy and Asthma, professor of pediatrics, medicine, and preventive medicine at Northwestern University. Welcome, Dr. Gupta.
Thank you. So happy to be here.
Thank you. So we are going to base our discussion on a paper that was published in 2019 in JAMA Network Open. The title of the paper is Prevalence and Severity of Food Allergies Among U.S. Adults. So when we were doing our research about food allergies and how this is influencing the different dietary habits in the population, the first surprise that we encountered was that the majority of the medical literature is focused on the pediatric population, not so much on the adult population from the epidemiological standpoint, even though it is recognized that this is a problem that is happening and is probably pervading in different areas. So, and I guess my first question for Dr. Gupta is, what led you to start putting together this important study?
That's a great question. Well, we had done pediatric studies, similar, prevalence of pediatric food allergy twice in 2011 and then again in 2018. And people were asking me, well, this is great, kind of what you said. We know now a lot about peds, but what about adults? And in the allergy community, we would be discussing how people were seeing more adults with food allergies. So we knew how to do it, prevalence study. So we decided we should really investigate what's happening in the U.S. adult population.
I see, and there's always a question, right? Is this allergy something that you are dragging from your infancy years, or is this something de novo that is happening in adults, and that is going to be answered in at least in great part by your study? So let's talk about, before we go to the study per se, with a little bit of background. So what are the most common allergies identified in terms of food for adults?
Yes, so for adults, it's a little bit different than kids. We still have the top 9 allergens. In adult population, one thing we found, which was really interesting before I get into the types of foods, is 1 in 5, when you ask adults in the US, do you have a food allergy? 1 in 5 adults said yes. 1 in 5, 20%. So many. Then when we looked at the responses, what food they chose and what symptoms they had, we realized that it seemed like only about half of those, about 10%, truly had a food allergy. Others may have been intolerances and other related conditions. But then when we asked, has your food allergy been diagnosed by a physician? Only 5% said yes. So 1 in 20. So, an issue this brings up for your listeners is, many people think they may have a food allergy. They may eat a food and have a negative reaction and then call it a food allergy, start avoiding the food, but never see an allergist to get it fully confirmed or diagnosed. So very, very important message is adults need to also, just like they take care of their kids, take care of themselves. And I know it's hard for us. I am guilty of it as well. But getting to an allergist and confirming, because there's many other, we call masqueraders or other food conditions like intolerances, sensitivities, oral allergy syndrome. There's a lot of other things that, may give you symptoms but are not a true food allergy. Now, your other question you asked, what are the top foods? So in the adult population, the number one food allergy in US adults was shellfish. It impacted almost 3% of adults in the US. So that was by far the highest. And after that was milk and peanut at about the same rate, then tree nuts, finfish, wheat, egg, soy, and sesame. So those we call the top 9 food allergens, but in that order for adults.
And as you mentioned, people may confuse a true allergy for something different, and it's important to characterize what is really an allergy. And I would say that an allergy constitutes a real problem when it is severe, right? So, and what would be a definition for a severe allergy? Something to definitely pay attention to.
Yeah. So, when we talk about severity, it's interesting in food allergy. We cannot say, oh, you have a severe food allergy, you have a mild food allergy. So much is involved in how severe your allergic reaction is. One of the big factors is how much of the food you ingested. Everybody has a threshold. So everyone can eat up to a certain amount of a food safely. That could be a tiny, tiny amount, or, half a peanut, for example. So knowing what your threshold is very helpful. But a lot of things influence severity. So the amount of food you accidentally ate, along with, is your immune system compromised in any way? Are you sick or have a viral or a bacterial infection? Other things, hormones can influence how severe, depending, especially for women. And then other things, like if you've recently exercised, a lot of the studies have shown that, exercise can cause, a more severe reaction if you've recently exercised. So there are a lot of factors that can determine severity. Any of these foods, you can have a severe allergic reaction. We call that anaphylaxis sometimes. And what that means is, the complicating thing about food allergies is it's not like asthma or, something that's clear cut. Like, for asthma, you're going to have symptoms related to your lungs, right? Breathing, chest tightness. With food allergies, you can have a reaction in any organ system. So for example, skin, hives. Everyone talks about hives, itching, redness, swelling. And then, a lot of times you talk about your throat closing, then you talk about trouble breathing, you go to your lungs, and chest tightness. You can have this with food allergies as well. GI, vomiting, is a very common symptom of food allergies. And then in anaphylaxis, it can progress rapidly, and you can even have a drop in blood pressure. So it can progress, and it can be very, very serious. Now, when we asked adults, have you had a severe reaction? Almost 70% of them said yes to peanut, and about 60% said yes to tree nuts. About 57% said yes to shellfish, same amount to finfish, and then soy, wheat, sesame, and egg, it was closer to 45%, and milk was 40%. So you see there's some differentiation in type of food, but all of these 9 foods, people were reporting severe allergic reactions.
Is it common for allergies to come, say, in a bundle? If you are allergic to, say, shellfish, you are also allergic to milk, or it tends to be like to an individual food?
Yeah, no, this is a really good question. No, some of them run together. So you are absolutely right. So a lot of people who have shellfish allergy also have a finfish allergy. Many people with tree nut allergies also have peanut allergies. Certain nuts also run together. So certain tree nuts also are commonly associated with each other. So oftentimes, egg and milk often go together. So there are foods, if you have one, you're more likely to have another. And, about 40% have multiple food allergies. So it's pretty significant how many are avoiding multiple foods. From your severity question, I also just wanted to mention in the adult population, about 1 in 10 adults said they were going to the emergency room in a given year for a food allergic reaction. So it isn't uncommon for them to have a severe reaction because they are going to the emergency room. And about 60% said they had been to the emergency room for a reaction at some point in their lifetime.
Yeah, when you think about allergies, usually the first thing that comes to mind is respiratory, right? And when someone is allergic to something and say has allergic asthma, usually they also have atopic dermatitis, other types of manifestations of allergies. Is it the same with a food allergy? So if you are allergic to food, can you, is there like a cross allergy to other things?
Yeah, so if you know, there's the whole atopic spectrum, right? So if you have food allergies, oftentimes you also have environmental allergies. A lot of times you also have eczema and you can have asthma. About 30% of people with food allergies reported also having allergic rhinitis, so environmental allergies, and about 30% reported having asthma, and about 15% reported having eczema. So, you know, it does cross over. And one other important thing is there's something called oral allergy syndrome. And this is often mistaken for, you know, a IgE-mediated food allergy. And what this is you're not reacting to the protein in the food, but you're reacting to the pollen on the food. So your symptoms are usually more localized. It happens with a lot of fruits and vegetables. But my son has it for avocado, for example. But what happens is you get more local symptoms around your mouth. So you could get hives, you know, a rash. Sometimes your lips and your tongue tingle. And sometimes you can feel a little distress in your throat. But this is more reaction to the pollen and not to the food protein. In a true IgE-mediated food allergy, you are reacting to that protein in the food.
So we could say that a true allergy, it has to be associated with an IgE-mediated reaction. So the other types of reactions are not really considered allergies?
The oral allergy syndrome, they are considered an allergy, but you're reacting almost to the pollen. So it's not a food allergy. It's a allergy to the pollen on the food. So a lot of times it happens in different seasons. And there are ways, if you wash it well or cook it, you may not have that same reaction. And, you know, some people tolerate it. My son loves avocado, so he's going to eat it anyway. And sometimes you can take an antihistamine like a Zyrtec, which will take away some of those localized symptoms. But typically it does not cause a severe reaction or a more systemic reaction.
Yeah, and I think it's important to make the difference. Now let's go to the study. So this is a big study. What can we say about the objective? What was the goal when you set up together this research project?
So this research project was really to characterize food allergy in the adult population in the U.S. And to better understand, you know, all these pieces that we were talking about, you know, the prevalence, so that 1 in 10 adults have food allergy, understanding, you know, potential misunderstandings or misdiagnosis, and then also understanding types of food allergies, which we talked about, in addition to severity. The one thing we haven't touched on, which was, I think, one of our biggest findings of this study, is adult onset food allergy. So like you said in the beginning, a lot of times we think food allergy is a childhood condition, right? And so we think, oh, it's kids, and I used to too. But what we found in this study, which was really surprising to me, is that half of the adults who said they had a food allergy, a convincing food allergy, about half of them developed a new allergy as an adult. And that's a lot, right? So when you break that down, so when you say, okay, 50% developed a new food allergy as an adult. So how do you break that 50% down? 25% of that said that they had a food allergy as a child and developed a new one as an adult. And the other 25% said they had never had a food allergy as a child and developed their very first food allergy as an adult. So what is so interesting about that is what's happening in our environment, because these adults used to be able to eat the food without any trouble, and now they are reacting to the food. All of a sudden, something was turned on, some switch in their body was turned on that now makes that food an invader, right? And their immune system is attacking it when, a couple weeks ago, it was accepting it. So understanding that environmental component is really critical, but we are seeing a rise in adult onset food allergies.
Yeah, that's for sure. And every time you know of people closer to you who are allergic to some food, and that's something absolutely relevant. So let's talk about the methodology. So this is a big survey. So tell us about the instruments. So what did you use to build this survey?
Yeah, so it is a very big survey. It's quite long as well, but what we did is we brought together a group of experts. We developed a series of questions. We used our pediatric survey, to start with, and then we edited it for the adult population. Some of the questions include, when we start with, do you have a food allergy? If they say yes, then we ask them a series of questions like, what food allergy? So then they list whatever, check off whatever foods they're allergic to. Once they do that, we go into each food. So say you say peanuts, milk, and eggs. We'll go to peanuts and we'll say, what is your most severe reaction to this food? Has it been doctor diagnosed? What testing was used to diagnose it? And then we ask questions around, have you been prescribed an epinephrine auto-injector? Have you ever used it? And then we ask them about, have you ever been to the emergency room? Have you been hospitalized? So there are a number of questions for each food. Then we'll do the same for milk, and we'll do the same for egg. So we were very, very strict because we came up with a criteria. So if you say, yeah, I have a milk allergy, and then I ask, next question would be, what are your most severe reactions? And you say, I have had bloating and stomach pain. We would take that out and put it into lactose intolerance. So we would not count it as a true food allergy. Now, if you said I get hives and vomited, then we would put it into a true food allergy. So we had an expert panel assess, each symptom with food and try their best to categorize it as a true food allergy or as one of these other food conditions. And then we would ask a lot of other questions. We asked about quality of life in this survey because we know that quality of life is significantly impacted, with food allergy because food is a part of everything we do in our lives, and we're, eating at least 3 times a day plus, parties and activities and snacks. And now around the holidays, it's all about food. Yeah. So it's hard to avoid, and it has a big impact on quality of life.
I see. And you mentioned the survey. Yeah, it's very complex. And I want to move on to ask you how many people participated?
Yeah, so we had around 40,000 adults who participated in this survey. And our methodology was also interesting because we used a NORC, which has a panel of individuals from that are characteristic of the U.S. population. So they do a really good job creating a panel. They give tools to underserved populations to be able to complete surveys. So you get more of a representative sample. Now, the problem with that is they only, I'm trying to remember now, it's been a while, had about 10,000 in that panel. So then we had to supplement it with one of those survey panels where they would, where they survey a large group of U.S. Adults. And so we took the survey panel and we weighted it with the 10,000 NORC panel to make it more accurate. So we wanted this to be a true representative picture of the U.S. population and, not biased in any way. So those are some of the ways, we got around how do you, get such a large sample. Now, we needed such a large sample to be able to understand details like specific food allergens, because if you really want to get into what are the most common, you need a larger sample size, plus to get into other intricacies around symptoms and severity. So 40,000 is kind of the number that we found that we would be able to truly have a good understanding about all these different aspects.
So when you say that you waited, what you're looking for is to to improve the representation of the participants to actually reflect what is happening in the general population. Is that the what you look for when you weigh the survey?
Yes. Yes, absolutely. Yeah, to be more representative of the general population, because usually when you do a general sample, you do get slightly biased results in terms of race, ethnicity, and income. So
Yes.
we were able to weight that.
Yeah, some of them are probably underrepresented, right?
Yes, absolutely.
Eh,
That's common,
mhm.
unfortunately.
Excellent. Excellent. So one of the aspects that is important is severity, and you mentioned that already. And one way to measure it is in terms of emergency room visits and prescriptions of epinephrine. So what did you find regarding those two aspects?
Yeah, so about, I want to say, um, less than half of adults said they had a prescription for epinephrine. Now, like I said, only 5% said they had seen a physician, for a diagnosis. So that is really concerning because, epinephrine is something we feel very strongly everyone with a food allergy should have and carry with them. Epinephrine is very safe. It's an epinephrine auto-injector right now, even though in the next couple of years we may have other devices, other choices. But right now we have an epinephrine auto-injector, and we have a couple different brands of that. But that is the one medication that should be prescribed to everyone with a food allergy, because if you do have a severe allergic reaction, your first line of treatment is to give yourself that auto-injector. So it's also for physicians very important. I think one of the big barriers for food allergy diagnosis, especially in the underserved population, is getting access to an allergist. A study we recently did, a different study, we found that only about half of allergists accept Medicaid. So that's in kids, but I'm sure the same is similar is in adults. So if allergists are not seeing, and there's only about 4,000, 5,000, and if only half accept it, you're talking about 2,000 allergists in the country, and we have 33 million people in the US with food allergies. So obviously they're not all getting in and getting a diagnosis. So, if primary care providers are listening, it is important to refer your patients to an allergist. But in the meantime, it is also very important, if you suspect a food allergy, to give them an epinephrine auto-injector and discuss signs and symptoms and what to look for and what to do.
Yeah, so we could say that as a result of this study, we should pay more attention to actually identify the true allergies, so that you know for sure I am or I am not allergic. And if you are, then
Yeah.
probably have better access to life-saving measures like the EpiPen, right?
Yes. Yes. Exactly.
Excellent, excellent. And let's say, because I think this is probably the best study that has addressed this question in the world, I would say. So what do you think are the main key takeaway messages here?
So for physicians, right? More than patients? Okay.
Yes.
For physicians, I would say key takeaways are really ask about food allergies. They're becoming really common. 1 in 10 of your patients will probably have one. So when you ask about, we ask about, do you have any drug allergies, right? We ask every patient that, and so add in food, do you have any food allergies? Or sensitivities, and then kind of get into it. Like if what are the symptoms? If they're more GI, looks like a intolerance, help them rule that out versus a true food allergy. If it is a true food allergy, or you suspect a true food allergy, definitely talk them through a management plan, prescribe epinephrine, and refer them to an allergist. I think those are really key takeaways. It is becoming more common. You are going to see more adult onset food allergies. And for primary care physicians, it's important that we do the first line stuff, because we know that many of our patients may never make it to an allergist. So I would say those are key. Top.
Excellent. And what about the recommendations for patients?
For patients, I think for patients, it's very, very important that if they eat a food and have a reaction, that they get to a doctor. That's number one. Number two is, identify what it could be. Don't just take a food out of your diet permanently, because it's hard to do. So see a doctor, understand, hopefully after this talk, what signs and symptoms are more similar to, two of the most common, masqueraders are that oral allergy syndrome I talked about, which is more, reactions around your mouth. And the other one is intolerances or sensitivities, many people call it, which is more GI related. So know that those may not be true food allergies. I was with a group yesterday, and many people are doing these over-the-counter tests, and do not do those, because they identify so many foods that it makes no sense. And I've seen so many people take, 10 foods out of their diet unnecessarily. So really get to a doctor, do the proper testing that they prescribe, and then figure out what exactly you have, and then take foods out based on what your doctor advises.
Yeah, and in the end, everything comes down to a better characterization and earlier treatment, if that is the case.
Yes.
And I think that this is great advice, and I think this way we can start wrapping up. First of all, we are very glad that you explained this to us. The importance of the study is critical, and our audience is going to have access to this paper in the description of the video, where we are going to put the link, as well as some details about the research group of Dr. Gupta. So thank you very much, Dr. Gupta, for being with us today. And it's for us, it's a privilege to have you here to share your knowledge.
It's my pleasure. Thank you for having me. And I just want to say, there's so much hope for food allergy now. We have prevention efforts, and in the next couple of years, we're going to have treatments. So if you do have food allergies, definitely do get connected. And if you're a physician, know that in the next 1 to 2 years, we're going to have new treatments coming out onto the market to help patients with food allergy. So it's an exciting time for the field.
Absolutely. That gives us all some hope.
Yeah.
Thank you. Thank you so much. And for our audience, see you in the next episode.